Yeah, I
Just
can tell you
rethinking that.
what the way that we approached it for our patients at Chicago Arthritis Regenerative Medicine was first and foremost safety. So we sort of immediately transitioned everyone to telemed. That could be handled telemed. Obviously, if we still had infusions, procedures, we'll talk a little bit about that, about safety kind of issues around that. We were still doing that twice per week in the office, but everything else was telemed. And so immediately kind of slimmed down the number of amount of foot traffic, and amount of people in the office. Thinking about safety for patients, thinking about safety for my own team in the office, that just seemed to make sense. I have concerns about how people are trying to jump back into it right now. There's just a lot of difference in terms of how people are approaching this, not only around the country, but even in our own state, in Illinois. And around the country, there's going to be differences based on how, just how people want to approach and how they want to take on risk. Here in Illinois, it's interesting because the Governor Pritzker, came out with some guidelines yesterday, and they're very conservative guidelines. It takes into account different regions in the state, which is smart. I think that appeases different constituents in the state. But it is really a gradual five-phase step to get back into normal life. And we're technically still at phase 1. And each phase takes like a month, which seems prolonged compared to what the rest of the country is doing. And it's a very conservative approach, but I think that may have to be amended as time goes on. But what I'm hearing from colleagues is that hospitals are starting to jump into their normal rhythm really fast. And I think that's dangerous.
Yeah, I feel like the Shriners are going really, kind of slowly easing back into this, like ramping up to get back to normal. But you got to go slow, and just I think the timeline looking out so far is a little bit helpful, so people can be in that mindset that this is going to take time. This is not like in 3 weeks we're gonna resume. Yeah.
I totally get the concern from the economic standpoint. As a small business owner in my own clinic, I totally get that there's concerns about how do you make payroll and pay for rent and everything, right? How do you keep the lights on? But I think humans in general have a real blind spot when it comes to risk. And we don't have a good sense for long tail or extreme risks. Like, it's just not part of our normal thinking. And right now, like, the best case scenario for COVID-19 in America is that we have like 80 to 100,000 people die. That's the best case scenario. The worst case scenario, we don't really know what the worst case scenario is. And I think a lot of people are looking at the math and saying, well, it looks like the mortality rate is only 0.3 to 0.5%, but they're looking at it with a really small, subset of time. They're looking at it as something that's happened in the last 5 months. We don't really know what this is over the next 6 months to 2 years. And I think going at this cautiously is smart. I think one of the strengths of this country is that people can try it different ways. And so I think we'll learn pretty quickly over the next month or two whether getting back into regular life was smart for some states. But I definitely have concerns because humanity does not know how to handle large unknown risks very well. And that's really what we're dealing with here. And so the new normal has to be very cautious for patient safety. And so I think people have regular medical issues that still need to be handled. So our autoimmune patients, they still need to be treated. They still need to be handled, but it has to be done in a smart and judicious way. And so while I get that hospitals and medical issues themselves have to get back into a certain rhythm, we need to stick with the technology that keeps patients safe, things like telemed. We need to be able to be flexible about reducing the number of people in office, continuing to do that for months, because patient safety has to be it right now.